Okay, welcome to another episode of Echoes and Ages, where voices echo and stories cut deep. Today's conversation is one that touches the very heart of health, healing, and humanity. Joining us is a man who works quietly behind one of the most important fields in medicine, women's reproductive health. He is a professional, a listener, a caregiver, and today we get to hear his side of the story. Welcome to podcast, Dr. Godfrey. How are you?
Thank you very much. I'm okay.
Karibu sana.
Asante sana.
Okay, so on our first segment, we would like to know who is Dr. Godfrey.
So thank you very much. Dr. Godfrey Mtaha is a obstetrician gynecologist. So I'm a specialist in sexual and reproductive health. But broadly, we deal with women's health, but we don't forget men. So we deal with men's health, especially issues related to fertility and reproductive health.
Okay, so tell us a bit about your journey. What inspired you to pursue gynecology?
Okay, so my journey began in about 1999 when I did my Form 4.
Okay.
And then from then, I had to expose myself to clinical medicine for about 3 years. Then I went for my journey in medicine in Makerere University. Then after that, I was in the field working most of the time in the county hospital. Most of the time I would meet women, especially in the maternity. And that's where I developed the eagerness to be a gynecologist. Then I did my master's for about 5 years in the Moi University. Then after that, I went back to work in the county government. Then after that, I'm now in the university. I'm the head of department in the unit of gynecology. So I think where I am, I see both patients and also train medical officers, also in term specialists or other people who are interested in women's health. So I think it's been a very long journey.
Okay.
And I think there's still more.
Okay. So when you went to school, you just studied general medicine and then ukaanza to specialize.
Yeah, so you do medicine first as a degree. So you do it I did it for 5 years, and then you have 1 extra year where you do your internship. So internship, you work under someone.
Okay.
And then after that, you can practice as a medical officer. Then later you sub-specialize. So specialty, you can do anything, surgery, or you want to be a pediatrician, take care of children. So I chose to take care of women's health.
Wow.
Partly men's health.
Okay. So was there a defining moment that drew you to women's health specifically?
Yeah, sure. When I was doing my internship with exposure to women, so you will get women who become pregnant like in their first month. And we keep on seeing them for like 9 months. And then after that, they deliver. So there's that positive impact that you feel that you create in women. And that's what made me think about being a gynecologist.
Wow. That is interesting. So what does a typical day look like for you?
So my day is not very fixed. Actually, it's sometimes very amorphous. But if it's a typical day, you wake up at about always 5 a.m. in the morning because you have to do some catch up with research, catch up with some leftover work, especially when it comes to training students. And then after 2 hours of that, I have to look at my family also, my children before they go to school. You have to interact with them. And then most of the time we have early surgeries in the morning hours, maybe up to 11 a.m. Then you do your clinic to see patients who have any problems related to women's health.
Okay.
And that can go on up to maybe 5 p.m. Or sometimes it can go late to 7 p.m. And sometimes during these hours, you can still get an emergency and you have to take care of women, either delivery
Mm-hmm.
do any emergency surgery if they're bleeding or
Mm-hmm.
maybe cesarean section.
Mm-hmm.
And then typically, ideally I sleep at about 9, but sometimes you can go up to 2 a.m., 3 a.m.,
Mm-hmm.
according to the work
Okay.
load of the day.
Wow. All right. Now we go to the second segment, and we're going to talk about women's health matters. And first question is, what are the most common reproductive health issues facing women today?
Okay, so we can say there are very many problems, but in a nutshell, especially for obstetrics and pregnancy,
Mm-hmm.
the biggest 5 are actually bleeding problems. Either they bleed while they are pregnant or bleeding after delivery, and actually blood delivering, like labor. And then in partly we have very women with menstrual, especially in their 30s and 40s with problems like fibroids.
Mm-hmm.
So there are very many problems, but I think those ones are the most common.
Wow. Okay. So how do you handle sensitive cases involving young girls, mothers, or women?
It's actually varied, but especially women who have the smell, they also get rejection maybe from their families or their spouses. Sometimes they lose them. We have stigma related to things like menstruation, especially for young girls. Like if you get a young girl, maybe 9-year-old, 10-year-old, having her menses, she doesn't even know how to take care of it. Sometimes the boys laugh at the girl, or the other girls also laugh at the girl who is menstruating. Then, of course, another important stigma is related to fertility. So most women who can't get pregnant, people think it's only a women's problem. They don't know that it can be a men's problem or a combination of both.
Yeah.
So you'll find sometimes they have rejection. They even separate from their family. And you may find maybe the man is the one who has a problem. So with stigma, number one, we do a lot of education and awareness so that you can be able to reduce this. And then for patients who cannot afford, we give them avenues of how they can afford treatment, especially in the public hospitals. And of course, we do a lot of research so we can give them the best when it comes to the skill in relation to the problems that are affected by stigma.
Wow. Wow, your work is a lot. So is there a myth or misconception around gynecology that you wish people understood better?
So the myths are diverse. Actually, they're very many, and I think I've already talked about it. So people think first gynecology is only for women. But I've said it's not for women also.
I actually thought that too.
So we also deal with men, especially things related to fertility, inability to have erectile function. So people who have a very low sperm count also deal with men.
Okay.
And then people think you have a myth that you only see a gynecologist when you're sick. We, just like mechanics, we can actually do service.
Okay.
People who are not sick, so you can come and we look at you. We do a lot of screening before you get a disease like for cervical cancer, sometimes breast cancer. So we can do some tests. We also examine you just for prevention. So we don't want people to come when they're only
sick. Okay.
Yeah, and then there are also myths in gynecology related to diseases, like maybe people who have fibroids. They think that you only have to do surgery. So we tell them that we have also medical treatment. We have several surgical options. People think when you have things like fibroids, you can't also conceive, you can't deliver normal. But I think we should just make people aware that we can do surgery. You can still conceive even with fibroids, especially if they're small. Yeah, people have a lot of myths about menstrual function, especially for young girls. You'll find that when a girl starts menstruation at a young age, like 9 or 10 years, they think maybe there's a cultural problem or witchcraft.
Oh, yeah.
Yeah, so sometimes we tell them it's just a normal. Sometimes the hormone can strike earlier. just like menopause, hormones can strike earlier than expected. Yeah.
Wow. That is a whole topic that we would like you to come in and just
sure,
talk
there's
about
a lot
that.
about it.
Yeah, especially when we talk about the fertility and the menstrual and, now these myths and misconceptions. And there is a lot of issues surrounding women. And would like you to come again and let's talk about that as a topic of its own.
Yeah.
So in your experience, how does culture affect how women seek or avoid healthcare?
So culture actually affects healthcare because number one is acceptance. So people don't accept, like for women who are especially infertile, you'll find that maybe they're told that this is, if you are a woman and you can be infertile, maybe just allow your husband to marry another woman. And so you'll find the woman is just there, and most likely she has a problem that we can easily solve. Then you can find maybe some who are pregnant. Maybe their culture does not allow them to come to the hospital. You can find them bleeding, and sometimes they can die in the community. And of course, partly culture and religion intermix. Like people can fear coming to the hospital because they don't want transfusion because of their religion or culture. So sometimes when they come, we can give them better options, even if it's not just blood transfusion. Yeah.
Wow. So do men also need to be part of the conversation with women? And
Yes.
Because you've also said that gynecology involves men, maybe you can expound a little bit.
Very key, not only men, but we say boys and men. So even as young boys they're very common in young girls. Then of course, women, especially when they're pregnant, if they have infertility problems, or whatever affects them, if it's mental health or any physical health. So men's involvement is very key. And as you know, our community also, especially when it comes to finance, the men are the ones who usually take care of finance. So we need to ask men to help empower women.
Oh, yeah.
So you can find a woman is in labor and is waiting for the husband to come so that they can be able to come to the hospital, or is waiting for an M-Pesa from the man so that she can get a taxi to the hospital. And that small delay can actually make the lady lose a baby or even herself, or maybe get complications that could have been avoided. Yeah, so men involvement is very key at all times for girls and women.
We were watching the Jesus family, and the guy was there, and he got.
Yeah, even as we encourage always, even women when they're in labor, they need a lot. And they're supposed to choose a companion earlier, even when they're just pregnant, who will help them, who will massage them, other than the presence of them when they're in much pain, delivery, all that. So a companion is very necessary. So the only problem you can find, like in our public hospitals, of course, because of congestion, you can find many women delivering, and you wonder how men will enter the same labor ward when you have very many women delivering in the same room. So we need to improve on maybe infrastructure, so that we can be able to give them a space where men whose women are in labor can actually be in a private room, be able to deliver, so that they have a chance, not that they enter the same room where women are all laboring and they're here because of things related to stigma and, of course, privacy too. Yeah.
In the public hospital, sometimes when you want to massage that woman in labor, they'll be like, no, just get out. She'll just struggle on her own. So it is advisable that you have a companion.
Always. So sometimes if the men can't come, of course, you can get a companion, maybe a sister or your mother, so that especially if it's a hospital where you don't get the privacy, because of course we have very many and pregnancy, especially delivery, is something you can't control at times because it's a natural process. So they can come 3, 4 at the same time. Yeah.
Okay. All right. So what can we do as a society to normalize opening dialogue around periods, fertility, and reproductive health?
I think the one important thing is just making people aware. So education is very important. And of course, involving the community, especially in research, education, so that they're aware that menstrual pain as a solution. Menstruation can start as early as 12 years. Our girls can get pregnant very early once the menstruation starts. So once we educate, make people aware, I think it will be very important. But of course, training people who can go to the lower levels of the community, like health centers, so that the most of the public can get access to healthcare, even if it's just a nurse, clinical officer, or a doctor. And then they have a channel of referring a patient who needs a specialist, because of course the specialists are not very many, but now of course they're in many places of Kenya. So you can get a specialist in most of the public or private hospitals. But at least if you have a way of referral from the lower community level, it's very important. And of course, another thing is to empower the community health workers who can be able to go up to the households so that they can refer most of the clients who have a particular problem.
Okay. So behind the white coats, Daktari, what's the most rewarding moments you've had in your career?
Okay, I can say the most rewarding moment is when I did my master's in obstetrics and gynecology. I say though because for the 5 years, I remember at some time we had a long industrial strike and we were wondering if we'll really finish masters.
Yeah.
And then, of course, COVID came in. So we were out of the hospital, out of school, and then go back to the hospital. Sometimes you deal with women who come, they can't breathe, they die. And sometimes you have to save the baby. I think that was the most
rewarding moment.
Because after that, I did my master's. But at the same time, I think that was the worst time of my career because I saw many women dying and you could do nothing because the COVID was already there. And they come when they're very sick. Yeah.
Wow. Okay, I think huwa nasikia watu wakisema kufanya course ya udaktari is very hard. I don't know how you manage that, but having a master's is a real reward. Congratulations.
Yeah, I don't know if it's hard, but I think it calls for, it's a call. And I think if you have passion and of course with enough knowledge and skills, there's a way you can feel good about it.
Oh, okay. All right. So what's the hardest part of your job?
I think the hardest part of my job is especially when we get a mortality, as in a death of a mother or a baby. Usually sometimes it weighs me or us down. So sometimes you really have to either get off or get some counseling, at least a break from the job. So that's usually the worst moment because it's a negative reward.
Wow, that's sad. How do you stay grounded and avoid burnout in such an emotional, demanding field?
Yeah, so for burnout, I think it's two-way. If it's related to like a mortality, you get a day or two off. Then, but generally, I make sure that I get time for my family. I get time to go at least for a holiday. And of course, we share with our colleagues. So you can ask a colleague to cover for you the time that you are going off so that you don't get many calls. And also you don't go for a holiday and you lose a woman because you are absent. So I think sharing tasks helps and getting time off.
Wow, it's a real job. So, Daktari, if you had a mic to the whole nation, what would you say to young women?
I think for young women, I think just be aware that there are many medical and gynecological problems from as early as the time you are born. So if you see anything unpeculiar, any sign or symptom that you're not sure of, please just get medical guidance from anyone who is available, whether a nurse, clinical officer, or a doctor, and have a way of getting a referral in case they can't help you. Yeah.
And Daktari, as we are still in that young women part, I have realized that so many women lose life, especially when they do abortion. And also, as you will be talking about the abortion part, could you also talk about the family planning?
Okay.
Yeah.
So I think for abortion, it's one thing that there's a lot of stigma and misconception. And you'll find that maybe people procure abortion in the community or people who are not well versed with, and then they even fear coming to the hospital. So in case somebody has procured an abortion, they are bleeding, don't die in your home. You can still come to the hospital. We have a way of helping you out instead of waiting for many complications, loss of blood. Sometimes the kidneys fail or even death in the community. So there are options in the hospital where we can take care of it. Yeah, what is the other?
On family planning.
So family planning, of course, there are a lot of myths about family planning. People say maybe you can get weight gain, you can get inability to conceive if you use family planning, you can get cancer. But we need to make people aware that that's not true. Family planning is very essential, not only for spacing your family, but sometimes we use it even to control periods, menstrual periods, when they are very heavy or painful. And family planning doesn't just cause weight gain. And even if it causes, there are options that we can use that are non-hormonal. And in case you're using any family planning and you get a particular problem, you can come for advice, or we can give you another method that can suit you. Yeah.
Okay. So what will you say to the parents?
So for the parents, I think they have to normalize making their babies or children aware as early as 9 years, especially for girls. Talk about menstrual cycle, talk about menstrual hygiene, how to take care of themselves, especially in the school, access to 9 to 14 years so that later they may not get cancer of the cervix after sexual exposure. So when the parents are aware and pass it to the children, sometimes it's very good. And for parents, you can discuss sexual and reproductive health as early as you can, so that their small girls don't get pregnant and they're wondering how, because they were not aware of what happens normally. So,
you see, when you talk of family planning to these young children, the parent would be like, you're exposing your child to be sexually active now that they know they can't get pregnant. But again, there are STIs and these AIDS.
yeah, so a lot of research has been done around it. Making children aware of something doesn't make them actually get involved in prostitution. Like, it's like saying if you make people aware of HIV drugs, all of them will get HIV. No. When people are aware of something, they know how to prevent it. They know when to use it. They know the side effects and everything. So making them aware actually makes them know that there's a danger, some risk somewhere. Because you can find, as I think we've had as early as 12 years, who are pregnant, they don't know anything. Nobody has ever talked to them. And even sometimes they wonder what is making their belly balloon. They even don't know they're pregnant. So sometimes I think making them aware, cutting that stigma, it's very important. Yeah.
How soon can a child be introduced to family planning?
So most of the time we don't give any family planning below 16 years. And even if we use family planning, most of the time it's not for prevention of conception. It's usually maybe for regulation of menstrual periods, especially if they are heavy or painful. But I will say the right time is individualized. It matters what the problem is, what is the particular reason you're using for the family planning. So there is no particular.
Wow. Okay, so any advice for
women, as long as you have any problem? We don't just do the treatment, we do a lot of education. We listen to you, we see if your problem is related to us, we'll take care of it. If it's not ours, there are other specialists who can take care of that, so we can still be able to refer you to them. Yeah.
Wow, that is a big one. So I think we've talked much on women, and we haven't talked much on men and the challenges men. I would like to know of the men that you've helped and what are their feedback?
I think for men, sometimes it's very difficult and not just stigma. I think fear and men being masculine, especially things related to fertility, especially if a man has a low sperm count, erectile dysfunction. First, they'll fear even coming. They'll fear what their friends will say. Even sometimes the women themselves make them fear. I think for men, I'll tell them, if you have a problem, we are there to help. So just come for, we'll be able to get the particular sign. We'll be able to know the particular problem. Psychological. We have drugs that can help you if you have erectile dysfunction. We have drugs that can help you if you have a low sperm count. We have opportunities like in vitro fertilization if you have any particular problem, like you have a low sperm count. So we give you very many options. And sometimes you can fear, and maybe you're not the one who has a
fear to come to the hospital, kwa sababu tumejua gynecologist ni daktari ya hospital. They tend to go back. Well, what are you doing to...
You may not control, because even you don't know there's a man on your queue. For men, you can also see a urologist. So a urologist also specializes in partly in reproductive health. Then you can come earlier or late in the clinic in reproductive health. Then you can come earlier or late in the clinic so that you're not with the... Make sure that they are comfortable on the queue.
Yeah. All right, daktari, you know, wanakwambianga atupeanangi.
Okay.
So, do you... wanakwambianga atupeanangi.
Okay.
So, do you mind maybe sharing your location where people...
For our phone numbers...
Maybe sharing your location where people...
For our phone numbers are very public, actually. So, handles Instagram. So you can just Google actually. So, handles Instagram. So you can just Google Mtaha Godfrey. So you'll find the Instagram, Facebook, Hospital Gain Clinic, or at Rupa Mall, our first floor, just above Java. We also have the Kakamega referral, where we also teach our students.
I understand that you're a lecturer too.
Yeah, I'm a lecturer in the School of Medicine, and I'm actually the head of department in the obstetrics and gynecology. But we've said also men's health. Yeah.
I'm sure your students must be watching. What will you tell them? They're your students.
For them, I just want to encourage them to become...
I mean, you're so good at and you're a mentor, probably.
Sure.
And probably they have a challenge while studying. What's your word when the going gets tough?
Yeah, I think for our students, they know very well we are very open and social. So we don't only discuss matters education, we discuss social life. We tell them what we've passed, what we've gone through from the days of our high school in campus. So we've gone through what they go through. Of course, there are some but we tell them that the environment is still the same. There are things that they should avoid. There are things that they can do better, especially when it comes to education. I think we tell them to keep an eye on education, because if you fail, most likely it will affect your future. And of course, if they have any particular problem, they can come to us. For the medical students, of course, we tell them there are very many openings. You don't have just to be a gynecologist. Of course, there are many specialities. Once you do your undergraduate, you can still see where your passion is. Yeah.
All right.
Then we tell them, don't just concentrate on being a doctor. There's a family, you can do business. There are very many things. You can become a politician.
Yeah, and maybe lead the health sector.
Sure, you can become leaders. Yeah.
How do you balance family and health? Because kuna this norm like, daktari atakwambia nimeitwa na kumbe ameenda shughuli zingine.
Yeah, it's of course it's very, you can say it's very difficult at times, but most of the time when you're in this profession, you find a way how you can balance, especially family, work, both like for me as a lecturer and of course for patients. So there's a way you balance. And I think for us, we make sure that when our patients need us, we can be able to avail ourselves either by if they call us, you can talk to them and book them. If it's an emergency, if you're not there, you can always contact some other specialists who can help. So there's a way you balance work and patients so that they don't really miss you.
Wow.
Yeah, especially when they're in trouble.
Wow, thank you so much, Dr. Godfrey. Mtaha.
Yes.
That is the name.
Sure.
What will Google? Tutandika hapo chini. Dr.
Godfrey Mtaha, yeah.
Mtaha. Thank you so much for the honesty, the wisdom, and for reminding us that care is not just medicine, it's human. And to our listeners, thank you so much. Let's talk about it. Ask questions, seek help, and take control of your health. Until next time, this is Valsi 254, and you've been listening to Echoes and Ages, where voices echo and stories cut deep. See you next time, the same place, the same day, every Thursday, 3 p.m. See you. Goodbye.